Om Shri Gurubhyo Namaha, Shri Bhavani Shankaraya Namaha, Shri Matre Namaha. Jai Shankar. Let us begin today's session with the Sabha Prarambha Prarthana. Dakshinasya Samarambha Shankaracharya Madhyama Asmadacharya Paryanta Smarya Guru Parampara Shruti Snuti Purananam Alayan Karunalayam Namami Bhagavat Padam Shankaralloka Shankaram Shankaran Shankaracharyam Keshavam Badarayanam Sutra Bhashya Krutau Vande Bhagavantau Punah Punah ईश्वरो गुरुरात्मेति मूर्ति भेद विभागिने व्योमवत् व्याप्त देहाय दक्षिणामूर्तये नमः परिज्ञानाश्रम श्री गुरु शंकर परिज्ञानाश्रम शंकर सद्गुरु केशव वामन कृष्ण पांडुरंग आनंद परिज्ञान गुरु सद्यो जात शंकर सद्गुरु गुरुर्ब्रह्मा गुरुर्विष्णु गुरुर्देवो महेश्वरः गुरु साक्षात् परब्रह्म तस्मै श्री गुरवे नमः। ओम सहना भवतु सहनौ भुनक्तु सह वीर्यं करवावहै तेजस्विनावधीतमस्तु मा विद्विषावहै। Om Shanti Shanti Shanti. A very warm welcome to all the viewers in this series of Atmabal. Our topic for today is common orthopedic problems. May I now request Dr. Chaitanya Gulwadi Ma'am to introduce today's session and tell us about the ongoing Atmabal series as a part of the Sayojam event. Over to you, Chaitanya Ma'am.
Om Shri Gurubhyo Namaha, Shri Bhavani Shankaraya Namaha, Om Shri Matre Namaha. On behalf of the Sayujyam team of Shri Chitrapur Mutt, I extend to all of you a very warm welcome to the Sayujyam Atmabal series, the 5th episode of the series. We've had a successful series of programs, and the 5th one is on common orthopedic problems, which is an interaction with Dr. Dilip Nadkarni. The interviewer is Dr. Minal Wagle. Dr. Minal is a very senior medical practitioner in Roha, Raigad district of Maharashtra. Not only that, she also is a dietitian and a nutritionist and a lifestyle management expert. She completed her MBBS from the Topiwala Nair Medical College in Mumbai and then settled down in Roha with her husband Dr. Anand Wagle, who is a child specialist, a pediatrician. She subsequently specialized in what is known as occupational medicine or industrial medicine and serves as a consultant to several industries in the Roha chemical industrial belt. In fact, she has been appointed as the responsible care auditor by the Indian Chemical Council. She also conducts training programs in industries, in schools and colleges on various topics such as first aid, healthy living, nutrition, lifestyle management, etc. In fact, I recollect she did a first aid training program jointly with me at the Paridyanashram Vidyalaya in Karla for the teachers, and she and her husband have been regularly conducting checkups for the children of the school and the teachers at the school. So over to you, Dr. Minal.
Thank you, Chaitanya Ma'am. The topic for discussion today is common orthopedic problems. Anything that is concerned with bones, muscles, ligaments and joints is considered as orthopedic. These structures are so essential to the movements of the body and our daily activities. Orthopedic problems can be seen in all age groups. In the younger age group, we often see problems like sports injuries, ligament and meniscal tears, posture, and computer-related issues. Whereas the other spectrum of problems in older age group commonly includes fractures, osteoporosis, osteoarthritis, spine problems, rheumatoid arthritis, and complicated surgical operations like knee and hip replacement. Let me now introduce our esteemed speaker, Dr. Dilip Narkarni. Dr. Dilip Narkarni is a renowned senior orthopedic surgeon with a multifaceted personality. Apart from being a skillful orthopedic surgeon, he is a musician, songwriter, golfer, author, and a motivational speaker. He is specialized in treating sports and fitness related injuries. He is a distinction holder at MBBS and a rank holder and a gold medalist at post-graduation in orthopedic surgery from Mumbai. He has performed over 15,000 knee surgeries. He is affiliated to Lilavati Hospital in Mumbai. Dr. Dilip Narkarni has written several books published by Times Books titled Real Fitness, Knee Problem, No Problem, and Kam Sutra, The Art of Relaxation. Mind you, it is not Kama Kama Sutra, it is CALM Kam Sutra. The latest book written by him is titled How to Avoid Knee Surgery. He has represented Mumbai University in table tennis. He now plays amateur golf and has won the Western India Seniors Golf Tournament. He is a songwriter and a music composer with original works to his credit. He creates socially relevant videos which have been viewed and appreciated by millions on the social media. I now invite Dr. Dilip Nadkarni to enlighten us on common orthopedic problems. Welcome, Dr. Dilip Narkarni.
Good afternoon, ladies and gentlemen, and thank you, Minal Pachi, for that lovely introduction. I'm sure there were a lot of exaggerations, and you're a little partial because we belong to the same alma mater, Topiwala National College. I'm delighted to be here, and let's start.
Yeah. Dr. Narkarni, in times of COVID, with the work from home culture and even children glued to their laptops and mobile phones for their online studies, what problems do they encounter due to prolonged mobile and computer use and inappropriate desktop stations at home?
Oh, an excellent question, because I'm seeing my son working from home since the last 18 months, and I can see what kind of pressure is there among the people who are working from home, because they are in a different environment. The workstation is not a workstation which they are used to in office. The posture takes a toss, and people present to us with a lot of neck and back issues which are posture related. The first thing, even now, the way I'm sitting now for this interview is not very ideal as far as posture goes. This was great for the camera framing, but I'm actually looking a little up at the camera. The best posture which is recommended is where I would be looking slightly downwards with my buttocks touching the backrest of my seat, and that would be ideal posture. But with things happening at home, parents tell me that little children who are attending school on their laptops and iPads, they are studying in Bhujangasana pose. You know, the laptop is kept on the bed and these guys are prone on the mattress with their neck going up in 30 degrees of extension. And then the young bodies can take it at this time. But if this happens on a prolonged basis, wrong posture, welcome spondylosis, welcome osteoarthritis, welcome muscle spasms in the future. So whether you're working from home or office, the main thing is that the posture at your workstation, Like we are desk jockeys, some of us, when I'm doing my music editing, or I'm writing my books or articles, or my banker's son, or the child who's studying online. We need to have a correct posture in which there is adequate elbow support. The height of the seat should be good enough so that our feet are comfortably resting on the ground. Our buttocks should touch the backrest, and the eye level, when you're looking at the monitor, it should be like as if you're looking at a point about 20 feet in front of you, but on the floor. So it's a small downward angle, and that is ideal. Posture is not all. We need to take frequent breaks. You need to get up. You need to stretch. You need to drink water. My trick when I'm doing these things is keep a large bottle of water next to me and keep sipping water. So what happens is automatically every hour I have to get up to go to the toilet. And this gives a compulsory break. And before I go to the toilet, I stretch, I do the Titanic pose, I look up, down, sideways, free my shoulders, free my back, and then I'm back to work with renewed gusto in a good posture.
What are the common causes of sports injuries, especially in young adults?
Okay, sports injuries are common, but I would rather get injured playing a sport than get a problem, orthopedic problem, having a sedentary lifestyle. So I am all for sport, for myself, for everybody. Yes, sport has got its share of injuries. Many of them can be prevented. The causes are extrinsic and intrinsic. Extrinsic because of the environment. If you wear poor shoes, if the running surface is not good, or your equipment is faulty, these are called extrinsic issues or causes of sports injuries. And most of these can be prevented if we select the correct shoes. Like if I'm a runner, I would wear running shoes. I will not wear tennis shoes for running. I would have, I would invest in the best pair of shoes and protective equipment, and I would buy a cheap shirt, if I can place this analogy. Intrinsic causes of sports injuries are when we are not fit enough for the sport. Now, what happens is a 45-year-old gentleman suddenly wakes up in the morning saying that I'm 20 kilos overweight and starts training for a triathlon. Now, this is not the way to go. One has to understand that you can't do a huge shock to the body when you are unfit. So you have to get fit to get more fit. So what would I advise the people? That if you are starting or embarking on a sports or fitness program, have easy steps into it. Begin with yoga, begin with breathing, begin with cycling, then go on to walking, and then maybe you can do running. The other causes of sports injuries are people have weak muscles. Some of the muscles, like a footballer whose thigh muscles or the quadriceps are not strong enough, or they are not flexible enough, like the hamstring muscle in cricketers. Uh, People go for a run and the partner tells him, no, 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 no. And one turns back. And in this process, what happens is that if the hamstring was not adequately supple or stretched, then you can have an hamstring tear or an injury. So there are intrinsic and extrinsic causes of sports injuries. One should look at fitness, which is very specific to the sport. Like if I'm a golfer, I see to it that I do my bhujangasan, I do my shalabhasan, I do my stretches, tadasan, and I just don't go on the golf course and start hitting balls. I warm up, I stretch my muscles, and that way we can prevent a lot of injuries.
Okay. What is the first aid for knee injuries?
Yeah, for any injury,
Yeah.
I want to tear RICE. I'm sure it's a very popular mnemonic. R is for rest, I is for ice, C is for compression, and E is for elevation. Now, a lot of us do the opposite, and that is called MASH. MASH. That is massage, activity, sprays and heat. Please do not mash your joint, but rice it. So in what happens is the person twists a knee on the sports field and the coach is in charge. Luckily now the coaches and trainers are well trained in first aid management. But if you happen to be on a sports field and your friend falls down, remember to get ice at the side and compress the injured part with the ice pack. Then how do we do the rest? We can put a brace around the knee or just ask the person to remain still till the medical advice comes. Never apply pain killing sprays. Now, what happens is that pain is a protective mechanism. If the spray reduces the pain, the person will go back on the field and a grade 1 ligament injury can become a grade 3 or a complete rupture. So, rest, ice, compression, elevation. What is compression? A crepe bandage. A simple crepe bandage, pink colored crepe bandage, you tie around the joint. And elevation, let the injured part be higher than your heart so that gravity will ensure that there isn't too much inflammatory swelling in the injured part. So, rice and not mash.
But what are the signs and symptoms of a serious knee injury, and when does it require attention?
Excellent question. I think atak, khatak, satak, and suji. Atak means the joint is locked. The footballer twists his knee or a kabaddi player twists his knee and says, Doc, I just can't straighten my knee. And that is called locking or atak gaya. What is khatak? Khatak means a sharp, painful click comes from the joint. And that sometimes happens if one of the semilunar cartilages or the meniscus is broken inside. The third one is satak or instability. The person says, as soon as I put my body weight, the knee just buckles down. And this usually happens when there is a ligament injury. Last but not the least is swelling accompanied by pain. What happens is if a knee is twisted, there can be rupture of some blood supply in the joint, and this comes as a swelling. And actually, I've seen the knee bloat like a football, and with the blood collected in the knee. So if you see your friend or your family member or somebody who has had a sports injury and has these symptoms of a sharp click or a locked joint or an unstable joint or painful swelling, I think after giving sports first aid, one must visit a sports injury specialist before it becomes too late.
Very often, the treating surgeon advises an arthroscopic surgery. So, what are the indications for this arthroscopic surgery?
Very good. The arthroscopy. Arthros means joint and scopy means to look inside. So that is the minimally invasive surgery which the orthopedic surgeons are doing to get the sportsman back on the sports field, or even a housewife who has broken a ligament or a office going person who has tripped and broken a meniscus. Now, arthroscopic surgery is first looking into the joint where the joint is projected on a television monitor, and then surgery is performed to repair ligaments. Ligament, as you know, is a rope which binds two bones together. If this rope breaks, the joint becomes unstable. So arthroscopically, we can reconstruct the ligament. If the joint atak gaya hai, which means it is locked, with arthroscopy, we can go in and treat the locking culprit. If it's a meniscus or a gadi in the joint, which is a shock absorber, it has broken and locked the joint, we can arthroscopically go there and remove the broken part or repair the torn meniscus. So arthroscopy is a keyhole surgery, usually a daycare surgery. And most of my patients, like the patient I've operated this morning, is already on his way home after his cartilage has been set right. So arthroscopy is minimally invasive procedural surgery. It's not just diagnosis. We can give results, we can give repairs, we can smoothen rough joints and hope to send the patient back where he began before the injury.
Okay. And how important is physiotherapy in knee care?
Oh, physiotherapy is as important as my surgery. In fact, if the physiotherapy is not good enough, my surgery will not get the desired results. Because we mobilize the patient very fast after the arthroscopic surgery, like even after ligament reconstruction, within 24 hours, my patient is standing on his 2 feet. Now, the correct way of walking is taught by the physiotherapist. The correct way of gaining joint mobility with correct stretching exercises is given by the physiotherapist. The physiotherapist ensures that the muscles which have rested for some time regain the vitality by doing the correct exercises to enhance muscle strength. Now, these are the functions the physiotherapist. Of course, they have modalities like ultrasound therapy and shortwave diathermy. But today, physiotherapy has moved more into hands-on mobilization. If the shoulder joint is frozen, then the physiotherapist will help the patient regain the range of movement which has gone due to the frozen shoulder. So today's physiotherapists are very dynamic. They work with their hands and teach the exercises in the correct manner. And without them, I think my orthopedic surgery cannot succeed.
Okay. Now, could you enlighten us on osteoarthritis? This is a common problem which is especially faced by middle-aged and the elderly. So, what is osteoarthritis? What are the symptoms, and how do we prevent it?
Sure. Osteoarthritis, osteo, bone arthritis is roughening of the joints. Now, what happens is today the life expectancy has increased, and with that have come problems of old age. I don't remember how much my great grandmother or grandfather suffered because they did not live as long as today's expected lifespan. So what happens is the medical industry is very efficient at keeping the heart, brain, and all the other organs very strong and functioning, so that life expectancy has increased. A person who was designed to walk X number of kilometers has walked maybe X plus 200. And what has happened is that just like the tires of a motor car go bald, the joint surfaces go bald. And the protective cartilage layer is gone. And this is osteoarthritis. Osteoarthritis presents with pain in the joints, limp, swelling, and restriction of joint mobility. Osteoarthritis is very often hereditary. So we can reduce the consequences of osteoarthritis, but many times we just can't prevent the whole thing. In my book, which is How to Avoid Knee Surgery, I have given a triple S formula for preventing. I would say preventing is a very big word, but to bring the incidence of osteoarthritis and the surgery for osteoarthritis to the bare minimum. The first one is supple. Now, supple means the joints have to be flexible. Luckily, our community is blessed with teachings of yoga, especially I being a product of the Vyayam Shala from Saraswat Colony. We were taught flexibility exercises right from the day we could start walking, and in a very fun way. So the joints need to be supple. Two, the muscles need to be strong. So the first S is supple, the second S is strong, and the third one is slim. Now this is where a lot of osteoarthritis gets compounded because the people are gaining weight. Now the same joint which was designed to carry 60 kilos if the person weighs 85 kilos, you can imagine the predicament the cartilage has to go through. And the hereditary factor gets multiplied many times if the person's flexibility is low, if the muscles are not strong enough, and add to that the burden of a heavy body. So triple S, remember, be supple, be strong, and be slim, and keep away from Dr. Nadkarni.
Okay, but sometimes patients do need knee replacement surgery. So, what is the indication? Who are the people who need this?
The patients have to decide that they need a surgery. We don't look at the X-ray saying that, oh, your joint is looking bad, or we look at an MRI that your cartilage has thinned out. The primary indication for knee replacement is patient is suffering. Pain is the primary indication. There are people whose X-rays look terrible, or they walk in a very funny manner, but they are able to do a lot of things. They can drive the car, they can walk kilometers. We do not do a knee replacement in these. But there are people who say that even walking 10 steps is a torture. Or another person who says, I can walk 10 steps, but I want to travel and you see the world, and my knees are not letting me do. So the indications are pain, number one, and two, people not able to do things which they would like to do, and the knee pain is preventing them from doing these things. So the indications are very clear. A lot of children bring their parents to me and say, Dr. Mom, please replace their knee. I said, why? I asked, Bache, kitl samkattu? Say, I can walk a lot. The child says, no, look at the X-ray, the bone is destroyed. I said, we do not treat X-rays. If your mummy says that she cannot walk 10 steps, or she cannot climb into a car, or she cannot climb or descend steps, and she is howling and wincing, and the pain demands, that is the indication for surgery.
How can we avoid knee replacement?
Knee replacement, the first crash course would be to lose weight. Now, I have experiences where we have actually paid the theatre deposit in the COVID times, and the COVID pandemic came in. And at least 3 or 4 patients went on a fantastic diet and exercise program which could be done at home. And many of them lost about 15 to 20 kilos in 6 months, because we couldn't do the surgeries. The theatres were shut, and only emergency surgeries were happening. And at least 3 to 4, I can remember, they came back when the lockdown opened a bit and says, doctor, just look at my knee now. I can walk and the pain has reduced by 90%. Now, see what magic weight reduction can do. Add to that a good yoga stretching exercise program, and very simple leg extension exercises which we show how to improve the muscle strength. Now, this is the magic. If it works, knee surgery can be prevented. And we can be hopeful that with today's, the public awareness like Atmabal, if we can reach out to people and they can understand how to lose weight, how to do sensible exercises, I think a lot of people could prevent going under the knife.
Okay. Now, what is osteoporosis?
Okay, osteoporosis is the other affliction which troubles the senior citizens. More in females after menopause, but the seeds of osteoporosis are sown much before the menopause occurs. Now, what is osteo is again bone, and porosis means weakening. Now, osteoporosis is where it's not just the calcium or the minerals which are less in the bone. The bone protein matrix into which the calcium is embedded also is lost. So if I can say what is osteoporosis, it is loss of bone density. Now, what this implies is because of loss of bone density and weakness of bones, people come with phatti gudaila mantati, where there is actually a kyphosis or the spine bends under the pressure of the body weight. The other thing is the fractures which happen because of weak bones. Now, this happens because the bone has lost its resilience, it has lost its density. Now, you see our wicketkeeper Dhoni, who falls 10 times in a cricket match, nothing happens to him. Whereas our neighboring Pachi, she just slips in the kitchen and has a comminuted or a many piece bone fracture in the wrist. Now, why did this happen is because of the osteoporosis. The education towards osteoporosis should be not when osteoporosis happens, but it should be in the younger age group.
So how do we treat and how do we prevent osteoporosis?
Okay. I have got one more formula. Just like I gave you rice, mash, and triple S, I've got news for you here. NEWS. The first thing is nutrition. The nutrition today, with junk foods and fast foods and preservatives and what all has come into our diets, we have to have a very strong look into nutrition. E stands for exercise in sunshine, which means we need to go out and walk and help our bones become stronger with the sunshine, which will help our vitamin D synthesis. W stands for weight training. And what is weight training? Weight training is simple exercises with the dumbbells, or you can use your own body weight. Like you can do a push up, you can do a half squat, and lower the bones, increase the muscle strength, and you can get very good, a background where osteoporosis can be reduced. Last but not the least, NEWS. The S stands for supplements. Now, supplements can be of various types. We have calcium supplements, we have protein supplements, we have vitamin D supplements, and sometimes it can be hormonal supplements. Now, osteoporosis is a very big drain on the medical industry and insurance system because ladies and gentlemen with osteoporosis can break a femur bone or break a hip. Now, this involves a very expensive replacement surgery, which could have been prevented. One is by accident prevention, and two is if the bone becomes strong and does not break, a lot of hardship and a lot of pain and suffering can be prevented.
Okay. Doctor, you just mentioned that we should increase the supplements like calcium and vitamin D. But should this be taken lifelong on continuous basis, or should there be a gap?
Yeah, I think all these should be monitored properly. We have blood tests now. I have seen people who are taking vitamin D supplements and their blood levels have gone through the roof. We should be doing regular tests like DEXA, which is a bone density test. We should monitor our serum calcium and vitamin D levels and see that we give them adequate but not an overdose of calcium and vitamin D. So if there is an excess, we must take a gap. Secondly, with the nutritionists who can monitor our diets, we should look at natural sources which will give us the nutritional supplements. If that is not happening, like there are vegetarians in whom the B12 supplement is definitely needed because they don't get enough dietary requirement. So I think it's a question of monitoring. And today, with such efficient laboratories around and accurate results, I think every person should have an annual checkup, get your bone density, get your vitamin D3 levels, get your calcium levels, and have them supervised by your physician so that you don't have a deficit nor do you have an excess.
What natural dietary supplements would you suggest to avoid osteoporosis?
No, I'm not an expert on that. You will be taking a lecture on that. Huh? If I start answering on diet, I will forget how to do surgery. No, of course, jokes apart, I think I was in a boarding school and I was a table tennis player there. So I was given an additional supplement of 2 extra eggs and milk and bananas and green pale bhaji. But I think just like we have experts in physiotherapy in orthopedic surgery, we must have a dietitian on the team. Like today, we are talking about sports medicine, in which it's not just the training, it's not just the injury prevention, but a huge amount of dietary inputs are going into the coaching or the build-up of an athlete. And I was part of the uh, bowling academy where we tried to find fast bowlers for India, and we had a full team with nutritionists and physiotherapists, injury specialists like myself. We had trainers, we had yoga teachers. So it's a multidisciplinary, and definitely I think you should have Atmabal should have one on nutrition and nutritional supplements for healthy living. I think that would be an excellent topic for the future, unless already it has happened.
Okay. You have written a book, Kama Sutra, The Art of Relaxation.
Yes.
What is it, and can a calm mind help in orthopedic conditions?
Calm mind can help in everything, including getting along with your spouse. It can help in orthopedic conditions. Now, orthopedic conditions and stress are very closely related. I've had patients in with backaches, and we have done everything. We have done their X-ray, I've done their examination, we have done an MRI, and nothing came out. And in the talk, I found out that this patient was highly stressed. So I made the person just sit opposite me, take a few deep breaths, improve the posture, listen to music, and most of the backache disappeared. This is not an exaggeration. There is a huge patient community with vague aches and pains. I'm not saying they are faking it. These are genuine aches and pains, but they are not caused by a slip disc. They are caused by stress in which the person is holding an abnormal posture. The muscles are tight. And when this happens 24/7 without relaxation, we can get fantastic diseases. And a calm mind. Calm Sutra says you must have fun in life. You must celebrate life. You must breathe. You must run. You must exercise. You must sing. Go out on the golf course. And all these fantastic diseases which are adorning all my medical textbook, many of them would not exist if we all adopted Calm Sutra. This book I've written basically for myself, that as Khalil Gibran says, just as I speak, I'm the closest listener. So to bring my stress levels down, I wrote it, and it has helped people. Times of India published it, and it went as a mini bestseller. Now it's available online. So Calm Sutra is a formula one has to decide for himself or herself. What is it? What is my passion? What can keep me away from worry? I can't tell a person stop worrying, he'll worry more. But if he can occupy his mind with music, meditation, breathing, outdoors, chilling with friends, a huge, plethora of diseases will get controlled. We have to just do it.
So, what lifestyle changes and daily exercise regime would you recommend for good bone health?
Oh, yes. Unless there's, of course, already existing osteoarthritis, I would say buy a pair of good shoes. And again, there is a small formula here called SWAN, SWAN. Stretch, weight training, aerobic exercise, and nutrition. So, stretching exercises, yoga, extremely important. Before you start any other exercise, just see that your muscles and your ligaments are flexible. Weight training, again, don't get me wrong. I'm talking to ladies also. It is not, we are not trying to become Hercules and trying to get bulging muscles. We are trying to get tone and strength in the muscles, which will help us prevent disease. Aerobic exercise. What is aerobic exercise? Aerobic exercise is any exercise where we burn calories in the presence of oxygen. So where you walk briskly, you swim, play badminton, you can choose what kind of aerobic exercise you like and with which you can get on, your whole life enjoyably. And of course, nutrition. Again, nutrition comes in. I'm not an expert, but I have a team which advises people how to, eat correct. So, for bone health, for any health, the SWAN formula is superb. Stretch, weight train, have a good amount of aerobic exercise and nutrition. Now, the whole thing about aerobic exercise is that I've told a lot of patients that you should do this or you'll get your sugars out of control. Please walk, otherwise your blood pressure won't be under control. But very few people listen. But those who tried, went out for a walk, enjoyed the walk, had their breeze on their face and came back nice and tired, these people get addicted to exercise and they continue for life. So, all the people who are watching, I'm sure in our Amchi community, all are, really loving walking. Just continue, spread the word, see that everybody starts walking. Chalo dildar, chalo morning walk pe chalo.
Okay. I think we have covered a lot many orthopedic issues, and we are also running out of time. So thank you, Dr. Narkarni, for the wonderful and lucid talk. You have really cleared our understanding of bone and joint problems. And if the audience wishes to ask additional questions, please feel free to write on scmsayujam@gmail.com and we will get back to you with the answers.
Thank you.
I would like to extend vote of thanks first and foremost to our Param Pujya Satyojat Shankarashram Swamiji for all the love and blessings he showers on us by providing us with such opportunities for learning. Pranams to Pujya Swamiji. A big heartfelt gratitude to the Sayujam team for tirelessly working on interesting topics for all of us to learn from. A big thank you to the IT and web support team which made this program possible. Thank you to all our viewers and audience for a patient hearing. Thank you once again, Dr. Dilip Narkarni, for making a technical talk so simple to comprehend for a non-medical audience. We will now conclude with the Sabha Samapti Prarthana. Nandantu sadhaka sarve vinashyantu vidushakaha avastha shambhavi mestu prasanostu guru sada sarve bhavantu sukhina sarve santu niramayaha sarve bhadrani pashyantu ma kaschit dukkhamapnuyat. Om Shanti Shanti Shanti.